Hello. Okay. Good morning, friends. At the outset, I am thankful to the organizing committee for this wonderful opportunity to interact with you all, lovely audience. The topic is HPV prevention. It is rather it not only she, he matters too. And for that, I am here. Okay, fine. What is HPV? HPV is a human papillomavirus. It is the DNA virus, so that's good. It doesn't get mutated that frequently at all. It gets mutated. It's the most common sexually transmitted infection worldwide. And mind well, 80% of sexually active individuals, they acquire HPV at some or other time in their life. That is that common. So that is very important. Now, how does this HPV spread? That is important because what you need is only two individuals and a sexual activity. So it may be a man and man, woman, whatever. And you require a sexual activity. So it can spread through vaginal, anal or oral sex with someone who has the virus. So yeah, definitely genital, rather vaginal, oral, anal sex, they are more likely to cause this infection. It also spreads by just mere skin to skin contact. So that's why even condom cannot be 100% protective. And a person with HPV can pass the infection, particularly he or she doesn't have any signs and symptoms. So he can transmit the infection without knowing the fact that he has been suffering. And at the same time, person who gets the infection, he also doesn't know when he has got an infection, where he has got an infection. And you need to have sex with anyone. So it is not required if you are doing a sex with only one person, that doesn't give the protection at all. So HPV is that important. Now, yes, there are more than 200 different serotypes of HPV and 14 are very important. What they call it is a more potentially high risk for causing cancers. Which are these cancers? For female, either it is a cervical cancer, vaginal cancer, vulval cancer, anal cancer for both men and women, and penile cancer for men. So this is the spectrum of HPV. So HPV, does it cause only cervical cancer? No, it can definitely. More than 95% of the cervical cancer are caused by HPV. But you can have vaginal cancer, 78%, vulval cancer, 15 to 48%, oropharyngeal cancer, maybe 13 to 60%, penile cancer, 53%, and anal squamous cell carcinoma, more than 90% caused by HPV. So that is the spectrum. So friends, there are two types, low risk type, that means low risk of causing the cancer. Okay, so that is 6 and 11, but it causes the anogenital wart. And mind well, this anogenital wart is very nasty disease. What has given dermatological index of urinary, here it is very badly affected. So there are high risk also. So 16 and 18, they fall into that causes more chances of a cancer. So now, when we talk about the timeline, HPV infection, once you acquire the infection, you don't get cancer right away. There is a long process, maybe 1 to 20 years. So what happens when you get infection, and if infection stays in your body for at least 1 year, then you have chances of getting progress of the disease. So you may get infection, then CIN1, CIN2, CIN3, and then the cancer. So what is that timeline? So if you say for more than 1 year, it will progress from infection to CIN1. From CIN1 to CIN2, again 1 to 2 years. So from infection to CIN3, it can be roughly 0 to 5 years. But what is the chances that once you got CIN1, you are going to get the cancer? Look at this. If you have CIN1, then almost 60% there are chances there will be regression. Only 1% will progress to cervical cancer. But if you have CIN3, look at this, only 33% will get regression, but 10 to 12% can progress to the cervical cancer. So it depends on which is the serotype, which is the level of infection, and it will progress. So it is a slow progress, but definite progress is there. So if you act early, you can prevent the infection, you can halt the progress of this particular disease. Now 16, 18, 6, 11, these are the 4 strains which have been taken care of by vaccines. So 16, 18, almost 83% of cervical cancer in India, and 6 and 11, 90% of anogenital warts are caused by these 2 serotypes. Okay, fine. What is the WHO approach? It wants to decrease the elimination of this particular, or eliminate this disease. How do you do that? See, you need to keep that case number less than 4 cases of cervical cancer per 1 lakh women per year. So if you can bring it down, then you can eliminate this particular disease. So how can you do that? There is a particular 90, 70, 90 formula. What is that 90? 90% of the female or the girls, when they reach the 15 years of age, you need to vaccinate them. One thing. Second thing, 70% of the women should be screened with high risk or high performance test by 35 years and again at 45 years. That is second. Third one, 90% of the women who have been identified this cervical disease should receive effective and appropriate treatment. Then only we can bring it down to 4 cases per 1 lakh women per year. Okay, now age at what you should start vaccinating. That's very important for all of us. Younger the better. Catch them early. So how do you do that? Why you do that? Because there are benefits of vaccinating at 9 years. Because we know that immune system is very robust and active less than 10 years. So if you vaccinate early, maybe 9 to 14 years, you are giving the vaccination when they are HPV naive. When they are HPV naive, the effectiveness or efficacy will be better. So you need to vaccinate them early. So 9 to 14 years is the ideal age to vaccinate. Of course, this is the time then the sexarchy believes. So maybe before the sexarchy begins, maybe 15 years, you should finish the vaccination. So if you start early, you will be able to finish it up. Of course, you need not to discuss more about the sexuality and the sexual activity to parents. That's very important. At the same time, you increase the number of vaccination that will help you to prevent the cancers. Okay, now this is the data of immunogenicity. If you give early, say if you give at 12 to 13 years, 87% reduction in cervical cancer cases. So that's why earlier is better. Now the question is HPV, not just her problem, he matters too. Why? Because HPV can cause cancers and genital warts in males too. Look at this, anal cancer 90% because of HPV, both male and female. Penile cancer 63% men. Oropharyngeal cancer 30 to 70%, both men and female. Men more than female. Okay, the HPV behaves differently in males. What is that difference? When you get infection, suppose with the HPV in male, so do men mount adequate response? No. What happens? Only 7.7% of the men who got an infection with the HPV, they really mount a seroconversion or antibody titers. So what happens? They are being infected, but they are not been seroconverting. It depends on the types also. So HPV 6, there is a 12.5% seroconversion. But when you talk about 16 and 18, it is 2 to 4% only. So why? That's why what this particular study says, that you get less seroconverted. That's why you become susceptible to infection. So men are more susceptible to infection because they don't seroconvert it well. And at the same time, if you are giving the vaccination, there is 100% seroconversion. So it will definitely protect your children. Okay, now how common is recurrent infection in men? So that suppose person has got infection, what are the chances they are getting recurrence of that infection? In man, the rate is 23.5% against HPV 16 and 20% against 18. So if you get infection in female, there are 25% chances they can be protective. But in men, there is no protection offered by infection itself whatsoever. So that's why that again makes a point that men should be vaccinated. How common it is in the man? 1 in 3 men worldwide is infected with any one of the genital HPV type. And when you talk about the high risk HPV type, 1 in 5 men, they have been infected with this particular thing. So this study which shows that if you just take a prevalence of this HPV in the man, the female, it is around 25%. So if you, 25% in the men only. So if you take a cohort where the female are suffering from the cervical cancer and you check the partners, 67% of men, they are having HPV positivity. That means HPV infection comes from the their partner, that's a male. That's why again it requires a importance. Anal cancers, how common it is? It is common. Only one thing is very important. 16 and 18, these two are the serotypes which are causing the maximum, almost 80% of our cancers are caused by these PQ2 serotypes. So in India, in 2020, almost 5,400 new cases and 2,700 deaths because of the anal canal carcinoma. So again, that is important. And anogenital wart, I told, yes, 1% of total population is suffering from anogenital wart. So that is also requires attention. So if you see this quadrivalent vaccine, which contains 16 and 18, 6 and 11. So particularly as far as anal cancer is concerned, almost these two serotypes if you cover, it is almost covering 80%. And rest 5 which are part of the non-anal vaccine, it doesn't offer much of the incremental value of offering that particular for as far as anal cancer is concerned. Okay, oropharyngeal carcinoma. Now this has been increasing worldwide, particularly in developed countries. In USA, it is increased to in the tunes of 225%. So that means now it is surpassing the cervical cancer in USA. Particularly this is happening more in US. Oropharyngeal carcinoma more common in men as compared to women. So again, that is important. So why male vaccination is important? One, susceptible to HPV infection throughout their lifetime. Why? Because there is a high prevalence rate. Maybe when the XRK begins, but that prevalence stays all throughout, so it doesn't go down. So there is a susceptibility to infection till late in men. While female, what happens, there is a peak, then it goes down the chances of getting infection. So that's why you need to vaccinate male. They are at risk of anal, penile and oropharyngeal cancer. There is a low seroconversion rate. As I said, there is lack of screening, routine screening, because for female, we have the pap smear and the screening. But for men, we don't have anything. Yes, there are some reports they are trying the penile glands sampling for the diagnosis of HPV, but it is not been standard of care. Then susceptible to new and recurrent infections. So susceptibility is there all throughout. So male vaccination is important. Now, how boys or men can be brought inside the circle of HPV protection? If you want to have both them together, then you have to have a gender neutral vaccine. And that gender neutral vaccine will also prevent non-cervical HPV associated diseases that have a serious morbidity in males as well. So these particular programs have been found to be cost effective. Of course, not at this particular cost, but maybe if it cost brings down, it's been brought down, it will be very cost effective interventions. And when you go from 3 to 2 to 1 dose is sufficient. Once you have that, definitely it is going to be cost effective. So gender neutral vaccination is almost there now in 81 countries all across the globe. And HPV types targeted by different vaccines can be eliminated from circulation with gender neutral vaccination. So it is very important. So what is the health authority? Particularly WHO says, yes, cervical cancer is very important for HPV vaccination. But if you have the feasibility and affordability, definitely you will vaccinate the boys. That WHO says. But when you are in practice, we don't have a question of affordability. So for ACVIP says, due to significant burden of the HPV related cancer, it recommends HPV in boys as well. Same CDC also recommends that HPV should be offered to male also. So advantage of vaccinating male, one, reduces the HPV transmission because ultimately it will send from male to female. Then it facilitates the eradication of HPV, it imparts the herd immunity and it protects from infection. So there are definite advantage of vaccinating males. This particular vaccine, it is a virus-like particle. So it is an empty shell without any DNA. So it doesn't cause the infection. But the external surface is just same like a virus. That's why it gives a proper immune response. So that's what is virus-like particle. HPV is available different. You know that we have Gardasil, that is international brand, which has been allowed to be given 9 to 14 years, 45 years. You have Cervac, there is quadrivalent vaccine to be offered male and female both 9 to 26 years, that is made in India. And another vaccine which is monovalent available, female 9 to 26 years, for male 9 to 14 years. So it is having a robust immunity, particularly immunogenicity. This Cervac phase 2-3 trial is showing 100% seroconversion, 1000-fold GMT rise and almost 100% seroconversion. Favorable safety, dosing. This is very important. This is the gender neutral vaccine, Cervac from Serum Institute. 9 to 14 years, 0 and 6 months, 2 doses for male and female both. 15 to 26 years, 0, 2 and 6 for male and female both. And it has to be given intramuscularly in the deltoid. It has to be toward 2 to 8 degree. So this is the product insertion. It is just like what is international brand quadrivalent available. Just something difference of aluminum hydroxide, which is 1.25, where it is adjuvant is 2.5. So affordability matters for the country like us. So we have developing countries, we have developed countries. What is the difference? Where screening rates are low, the HPV vaccine is the best line of the defense against cervical cancer. And what happens? The number of diseases are more, incidence is more in those countries where these facilities are not available. So vaccination is only way out. So affordability matters. Cervac, Serum brand, 60% cheaper than imported alternatives. It supports even the school-based program because we can give it to not many number of the children. And it improves the equity in HPV prevention across India. So there is the Lancet paper which says HPV, particularly from Serum, is a silver bullet for cervical cancer. So in nutshell, what I can say is Cervavac is sustainable, high volume, high quality and cost effective HPV vaccine. So key take home messages are HPV vaccination 9 to 14 years is critical. So you need to start conversation early, start vaccinating them, finish the vaccination before the sexarchy begins. Cervavac offers us evidence-based affordable protection for girls and boys both. It has been tested for both 9 to 26 years. You can give it to male and female both. Only the number of doses required. Pediatricians, we are a pivotal to achieve WHO goal of bringing it down to less than 4 cases per 1 lakh women per year. HPV, not just her problem. He matters too. And for that matter, we need to vaccinate males too. Thank you so much. If you have any questions, I'll be happy to answer.